Alright, so then back to here. So here we have, again, the vulva being shown right here. Now we're going past the vestibule. So again, we have and this is an interesting thing, like labia minus, that just refers to one of the labia minora. So again, between the labia minora, the vestibule is this part. You're not quite at the vagina yet. So you have to go past the vaginal entrance here and the hymen if it's still intact. Then you enter the vaginal canal. And then you have rugae. So again, just like the rugae in the stomach are these little folds, you also have these little rugae in the vaginal canal, so all these little ridges over here. And then you have the vaginal fornix. So the vaginal fornix is the area kind of like the vestibule, but instead of just being before the vagina, now it's just before you enter the uterus. So that's what we have with the fornix. But before you even enter the uterus, the part of the uterus that projects into the vagina is called the cervix. Now you might be like thinking, doesn't that sound like cervix as in like cervical? And it does come from the same root word. So it's kind of like, they call it that because they're like saying it's the neck of the uterus. So what happens if we go here? So this cervix, and this opening that goes from the vagina into the cervix and into the uterus is called the external os. Yeah, that's what's called. I don't know why it's called os. Like, I should look up the Latin term, but that's what we have to work with. And then we're finally at the uterus. Now, what we have here with the uterus, well, let's rewind a bit. So what we see here is a pap test. And what are they doing? Well, what the OBGYN is doing is trying to get a sample of cells from the cervix. So what they do is take a brush or another instrument, and then they're going to take a sample of the cells from the surface of the cervix. But notice that you have the brush, but something has to hold it in place. And what we have here is an instrument called a speculum. And yeah, so the speculum is going to hold open the vaginal canal so that you can guide that brush to reach the cervix and get a sample of cells from the surface of the cervix. Now, what are they doing? Well, they're going to do a pap test to look for a pap smear. So what we see here is a sample, and why do women go through these tests? And it seems very invasive. And from what I hear is like the OBGYNs, they do not warm up the speculum. So I'm thinking like, ooh, man, it already feels kind of cold. To have anything cold down there is already kind of like a sensation itself. But can you imagine a cold steel thing? Oh man, if I was like OBGYN, I would probably have like a hot water bottle or something if the woman want to warm it, if they want it cold steel. But yeah, again, this is like why it's kind of like, oh, anyway. So what are they testing for is like cervix is what we have here is a cervical cancer. So what we're trying to see with a pap test is that trying to get a sample of these cells to see if they're potentially cancerous. So this is the cervix as you see through the speculum as seen from the vaginal canal. And then we have all this cancerous tissue. So what we should see in a normal cervix is a pretty smooth tissue and like and what they're going to do is take a sample of these cells, and then a special allied health professional called a cytotechnologist or cytotech, then they can look at these cells. They're trained to look at these cells under this kind of stain called the Papa-Nicolau. I'm probably butchered that name, but the funny thing about the pap smear is that it's actually named after a person, and coincidentally, the human papillomavirus is often a common cause of cervical cancer. That's why we also have that Gardasil shot that tries to prevent cases of cervical cancer. But what we have here is like normal cervical cells. Cytotech will be able to look at that. And with cervical dysplasia, what we have here is that cancerous or precancerous cervical cells, they look different. Like you see here, multiple nuclei, or maybe they stain differently due to changes, or their nucleus is a little more diffuse. So that's the other cool thing. Like medical professionals and allied health professionals, there are multiple things than just doctors, nurses, pharmacists. So cytotechs, that's one of the best kept secrets. Like maybe after you get your bachelor's, you maybe need to do a year or a year and a half cytotech certificate, and then with like that maybe 1 to 2 years of post-bac studies, you can actually make. Let me look up the salary for a cytotech. Cytotech on salaries.com. So cytotex in Hawaii, on average, it says you can make up from 65K to just under 106 figures on average. So that's the thing too, is like you can actually look at things. It's not just pap smears, but again, that's if you're thinking of if you're going to graduate and you don't know what to do with your BS Bio, maybe that's something you can do. All right, so then again, this is why those pap smears, and even though that speculum is cold and it feels like, okay, why am I going through this? It's to prevent cervical cancer, because you don't want to develop cancer, period. But again, this is one way of detecting cancer in the cervix. All right, so then with the cervix, now we're going to end up in the uterus. And the uterus, now this is another view of it. Now, what do I want you to get from this picture? Well, notice that the uterus is not just floating around in the middle of an interstitial fluid. It's actually pretty anchored down in the pelvic cavity of a woman. And what we have here is like many ligaments. So we have our uterosacral ligament connecting it to the posterior. We also have ligaments that hold the ovaries and fallopian tubes or uterine tubes in place, and also ligaments that anchor the uterus to the anterior. So what we have here is that the uterus is pretty held firmly in place or suspended in place by all these strong bands of dense connective tissue. So it's not just like, yeah, even though there is flexibility, it's not just floating around. And I think this is a picture from the textbook we don't have, but I think it also demonstrates the location of the uterus in the pelvic girdle pretty well. So again, the uterus has many ligaments that kind of hold its shape and also anchor it to the overall pelvic girdle itself. Now, hysterectomy. So they don't call it a uterectomy. So hyster is also a root word from Greek. So Greek root word for the uterus is this hyster or hystera. Now, hysterectomy is when, say, a woman has like uterine fibroids or bleeding or other pathologies that can't be cured by other means. She might elect to do a hysterectomy. And there are different degrees of hysterectomies. And what we have with the partial, you remove most of the body of the uterus, but you still keep the cervix. Or if you have a total hysterectomy, you remove the uterus, but you keep the ovaries and you keep the vagina over here. And radical, they actually remove the upper part of the vagina. They still keep part of the vagina, but this is what we have here. Like hysterectomy, you're removing some part or all of the uterus. And why might you keep the ovaries? Well, say a woman is still menstruating, and the ovaries, as we'll learn next week, are very important in producing female reproductive hormones. So they're the hormones like estradiol and progesterone are the whole reason behind the menstrual cycle. And what happens when a woman stops ovulating and they stop producing these levels of progesterone and estradiol seen during menstruation or during ovulation and the menstrual cycle? Well, that's when we have menopause. And menopause, all the symptoms associated with menopause, largely contributed by the drop in hormones. So this is why you might want to keep a woman might elect to keep the ovaries if she's still ovulating and of that age. So hysterectomy is a surgical removal of the uterus.